Allegheny Health Network has been doing a lot lately to treat postpartum depression. Just like other areas of the country, postpartum depression really affects a significant portion of our patients. We recognize that currently patients do not have adequate opportunities or resources to get the care that they need. We, together with some of the national leaders and experts in postpartum depression, built a program that has 5 fundamental components, and those components involve adequate and best-in-class screening, improved access, mother-baby care, education, as well as a family approach. The first pillar of our program involves best-in-class screening, and that means that we're using 2 questionnaires. Most places typically use only 1 questionnaire, but we're using 2 questionnaires, the Mood Disorder Questionnaire and the Edinburgh Depression Questionnaire. And we give the patients those questionnaires at multiple points during the pregnancy as well as in the postpartum period. We've even involved the pediatricians in providing questionnaires to our patients because we know they're the first physicians to interact with our patients after delivery. Patients will fill out the questionnaires on an iPad confidentially in the office. The results will get synced up to the electronic medical record, so the physician during the office visit will know if the screen was abnormal and will be able to then reach out to our nurse navigators to get the patients in as soon as possible. So we've done a lot in terms of educating the consumer as well as the physicians, the providers. We've had a number of symposiums for the community as well as obstetricians, our nurses, our ED physicians, as well as our pediatricians to make sure that they're providing the best care and the best screening possible for our patients. But we've also done a lot in terms of media. We have a number of television spots through our All of Her Life campaign where we focus on a number of different medical conditions. And we feel that by providing these television opportunities, we're increasing the awareness so that patients who may be on the fence, who may not know what to do or where to go, they feel that they are more empowered and they feel more comfortable reaching out and getting the care that they need. Mother-baby care is really critical. Typically, care in this country is fragmented where mom and baby are separated, and this is a critical time for the mom who's suffering from postpartum depression. We know that if we keep mom and baby together, we have a better outcome.
Postpartum depression affects about 1 out of every 7 women. And I think it's more common than providers truly realize. It's actually the #1 complication of pregnancy. There is a lot of stigma around mental health disorders, and it's something providers need to get better at talking about with their patients. I think there's also a preconceived idea that the postpartum period is supposed to be the happiest time for a woman, and that makes it extra hard to reach out to a provider and tell somebody that you're actually struggling and you're feeling sad and having trouble connecting with your baby.
Hi, my name is Brianne and I am a postpartum depression survivor. Let me tell you a little bit about my story. Shortly after the birth of my second daughter, I started to experience some symptoms, which were moodiness, very tiredness, and my patience level was pretty low. It was about 3 or 4 months in that I realized that something was wrong, that I knew that this wasn't baby blues, that there was something difficult. But it was about 6 months before I went and actually sought the treatment, before my sister-in-law had reached out to me. And after she did, I called within 2 days, and I had an appointment within 2 days at Allegheny Health Network. Getting the help that I needed from Allegheny Health Network changed my life in so many ways. When I first started coming here, from the very first visit alone, I left that office feeling hope that things were going to change and that things weren't going to be as sad forever. I was going to slowly begin to find my happiness. I know that it feels like you're alone, but you're not, and we are all here. You have a whole system and a whole support behind you.
Hi, I'm Steven, a postpartum depression advocate. My story with postpartum depression started in August 2013. My wife, Alexis, suffered with postpartum depression, anxiety, which eventually turned into a postpartum psychosis. And over the first couple weeks, the symptoms progressed very rapidly. She fell apart very quickly, and was also very aware of the trouble she was in and was desperately seeking treatment that unfortunately at the time just didn't exist. October 10th, 2013, my wife lost her battle with postpartum depression and took her own life. A woman from Allegheny Health Network and another woman that was with Highmark, and we were kind of talking, I was explaining my story, and we kind of left with this feeling where they both reassured me that we were going to get this done because it was the right thing to do. And it's hard to admit you have a problem and then say, sorry, we don't have anywhere for you to go. So AHN and Highmark have done the right thing and created this safe environment for new moms to get treatment with their child.
At Allegheny Health Network, we have a mother-baby intensive outpatient program, which is 3 hours, 3 days a week. And it's a special program that is designed just for women who are either pregnant or postpartum, suffering with more severe symptoms of depression and anxiety.
We're one of only a few centers in the country that's keeping mom and baby together for intensive outpatient therapy. The family is involved in the care. They understand what the patient's going through. They understand warning signs of what to look out for. And sometimes the family members themselves are going through a lot in this process and they need some extra care as well. We want Pittsburgh to be known as the best place in the country for new moms